Right. Hello, everyone. Patricia Ivan here of HarvestSprings International. Another day in our mental health week, and I've got someone that I really admire the work that they do with me, and she'll be sharing some of our experiences with us. Her name is Lystra Charles. I'm going to say a little bit about who she is, and I'm sure you'll hear from her, and I'm sure you'll find whatever she's going to share with us very helpful. So Lystra Charles, I met her, I think about 2 years ago, or maybe even 3 years now. I know she co-founded a community interest company, Hope Atrium, and they have a number of projects. I think we've really connected on From Thriving to Surviving, which is a project that really focuses on raising awareness of mental health, which is what we are doing here today, particularly within the Black African minority communities, but also raising champions, community champions. And I'm sure she will share something around that as well, because a lot of faith leaders have actually gone through those programs and are able to go into the community and do amazing work. But it's not limited to that. They've got a parent program, parent leadership program, which again is about increasing the leadership skills of parents in their role as a parent. I believe that is strengthening families and strengthening communities. And also there is the Get Ahead program, Get Ahead Learning Center, which focuses on really disadvantaged children being able to attain their full potential. So really incredible and amazing work. And I know it's taken a lot of sacrifices in Lystra, having come away from the high-flying job of, head of customer management with an experienced company. Quite a change, but of course, that's what passion helps you or makes you do. So good to have you on this this afternoon. The sun is really lovely out there. So welcome, Lystra.
Thank you. Thank you. Hi, Patricia. Just one correction. The main program that we're focused on at the moment is From Surviving to Thriving, is the name of the program, and FS2T for short.
Yes.
It's a pleasure to be here, and I thank you very much for extending your offer to me to speak about mental health and the current situation that we find ourselves in with this COVID-19. And yeah, thank you. I'm really grateful for this opportunity.
Oh, thank you more. I think when we were speaking yesterday as well, I was thinking about what you were saying about, you having a very close relative who is in the healthcare sector. I think, what we're doing as a nation, clapping for our NHS workers on Thursday night at 8 o'clock is really amazing and commendable. And then we have the Colonel Tom that raised so many millions for the NHS, but just really hearing the day-to-day challenges and how that pushes our mental well-being, both from yourself and you also trying to lend that support to your loved one. I really feel that a lot of people can connect to that in this time and in this season, and even more so in that mental health week. So, I'm grateful that you're willing to share about that, and also tools that could help us, manage those emotions. So please feel free.
Yeah, I think when we were talking a few days ago, I happened to mention to you the current situation in terms of COVID-19, and my daughter who works on a ward at St. George's, and she's actually working on a COVID end-of-life ward. And I know that when she mentioned to me that her ward, which is ordinarily a thoracic ward, had been changed to a COVID ward, she wasn't at work at the time. She was off work. And when she went back into work, I think that's when the sort of panic arose. I mean, prior to that, I went straight into prayers. It was, Lord, you have to take control of this right now, because I can't afford for this to take control of me. I have to be strong for her. And I waited until she went back to really get a full understanding of what the experience was of working in a COVID end of life ward, where they were seeing multiple deaths on a daily basis, and that in itself is trauma for those who are on the ward. And it's not that they've not experienced death on the ward before, but they're experiencing death in a much higher rate on the ward. And so for me, it became very important that I connected with her on a daily basis, so that she could offload onto me what she is going through during the course of the day, and for me to then find a way to be able to deal with it. And I remember saying to you that when she went back to work, the ward was an amber ward. They code them green, amber, and red. And
Right.
several weeks after going back to work, they decided to move it up to a red ward. And on that day, I remember the anxiety that it raised in me, the fear of knowing that on a daily basis, my daughter, my firstborn, is walking into a ward with people who have been diagnosed and are not just diagnosed, but the view is that they are not going to survive this virus. So they've been put on this ward to die, effectively. And thinking of her, she also has, a partner, 3 little children, and my fear was her bringing things home from the hospital and so on. And I had to go into a serious prayer session to just ask the Lord to keep my mind free of anxiety and fear, so that I could be the support that I need to be for her. And then I had to go into a praise and worship session, just giving God the glory and the praise, because he's brought us this far. And I know that he will bring us the rest of the way. But that immediate fear that you feel, and for me, we all feel fear in different places. And my fear is right in the pit of my stomach, and it makes me feel nauseous and so on. And I had to deal with that. I had to deal with it pretty much immediately. I couldn't allow it to go on for a long period, because if I did, then the anxiety would overcome everything else that I was wanting to be able to deal with. So I focused on that, and I focused on praying for the ward and praying for the staff and the patients and so on. And sort of within a relatively short period of time, I felt the peace of God, I felt the ease, and I felt the whole, you don't have to worry, she's in my hand, she's in my hand, she's in my hand. And that's how I've had to deal with that. And daily I speak to her. So how was it today? Did anybody die today? How many people were discharged, and so on. And fortunately, in the last 3 weeks or so, there's been more discharges than there have been deaths. So that's been really, really, for me, that's been really good. Yeah.
Oh, wow. Wow. I think that's just incredible. I mean, I was thinking that, when you came on and I introduced you, the bit I didn't say is that you're also a systemic family practitioner. So you're a mental health professional, just not just coordinating projects around mental health, but, just listening to you and, talking about the tools, your faith as well. That's the other bit, isn't it? That you're a person of faith, a woman of faith, and how you were recognizing the mental health challenges at that point, based on what is going on around us, but also using your faith to leverage that. You were talking about the fear, building up into anxiety, but, praying about that. Can you say a little bit more about that, how we can, because sometimes, particularly within the faith community, we don't think these two things go together. And what you are saying is that they do go together. Recognizing those areas, it's not denying, faith is not denying that we have a mental health and mental well-being that we need to be cognizant of, and what we can do when it's not where it should be. Are you able to say a bit more?
Yeah,
Please?
definitely. There was something about the systemic training that is really, really helpful. Like when I entered into the training, it was we entered into it from an aspect of people of faith doing systemic therapy training. What I got out of that was the importance of recognizing when there is a mental health issue going on and bringing in the external interventions. So prayer is an absolute must, because for people of faith, that's where we go to first. Pray. We lift up God's name. We bring everything that we have to him. But you've also got to be very mindful that there's other things going on. People of faith are not completely exempt of mental health challenges. Mental health challenges are there wherever and whoever you are, and we all have mental health. You know, on the mental health spectrum, we're somewhere between, you know, poor mental health and really good mental health, on a daily basis, on a weekly basis, depending on what's going on. And for me, the whole situation, when I was told by my daughter that they've become a red ward, the anxiety that I felt straight away, but the work that I've done in terms of systemic work, and also the work that we do in the Hope Atrium, allowed me to be able to step back and connect with what I was going through and how I should deal with it, rather than allowing the anxiety to consume me totally and then not be able to do anything about it. So I think there is something really important about being able to connect with your mental health or mental well-being, and also others, so that you can recognize when you're seeing something that isn't the norm in that person, or it isn't the norm in you. If you're somebody who is an overcomer and you get through things, you know, with some challenges, but you're able to get through, you need to recognize when your mind is going somewhere where you need to pull it back from and actually start to work on it. So I do apply my own systemic work to myself, as well as the Hope Atrium work that we do, and prayer. So I mix the whole pot together to ensure that I'm staying. I'm always asking myself, so what is it that you're seeing or hearing here, Lystra, that causes you to feel this way or that way? You know, what is it that you need to do at this point? Well, actually, okay, you need to go and you need to take this to God, because this is God's. Or you need to stop and you need to recognize that your mind is going somewhere that's really unhealthy. So step back, pull it back, and let's just do some work. So yeah, the whole thing, everything goes together, but you've got to learn how to connect the dots to make sure that you are seeing what it is that's wrong. You're not just sitting in it, you're actually doing something about it.
Wow. Well, very well said and perfectly put. I was going to ask you for like a summary of the things that we could do to really look after our mental health, and you've really summed that up very nicely. Just one last question. What are the, you know, where could you signpost people to? I think, you know, your daughter has been privileged to have you to talk to, because you did the prayer, you did the worship, but you also engage with your daughter so she can offload onto you. For people who don't necessarily have that support or don't feel like they have that, what other places could you signpost them to?
I think there are many different places that you can go to when you feel you're being challenged by something, particularly in this time of COVID-19, because anxieties could be raised so very, very quickly. You know, you turn on the telly and you accidentally turn it on the news, and they're talking about the numbers of deaths, and immediately you start to feel the panic raising in you, and so on. So one of the things that I will say is to not get too caught up in negative things, not allow yourself to be fed negative things, like, you know, watching every news broadcast and every video that comes through on WhatsApp that has negative bits to it. No, feed yourself with really mind lifting things that's going to take you to a place that makes you, that elevates you mentally. you know, there's loads of podcasts and so on YouTube. There's loads of different ministers preaching on YouTube. There's lots of different things. There's an app called Abide, you know, and it takes you to different worship sessions and reading of psalms and prayers and so on. So that's one of the areas. The work that we do, for example, at the Hope Atrium, which really is about equipping in terms of the From Surviving to Thriving program. That's about equipping people to understand their mental health and you know, the difference between good mental health and poor mental health, and how important it is to hold on to really good mental health. So you've got to feed yourself with really positive things to keep your mind at its peak, particularly at this time where it's so easy to fall into, oh my God, I've just heard this really, you know, terrible news and they're talking about death and so on. It's actually finding something that will keep your mind focused on really good positive things. And there are other areas. I mean, if you're going through a period of you know, where you're actually feeling really fearful, you're feeling really anxious, and it's starting to impact on you, you've got your GP, you know, your health practitioner to speak to about that. You've got organizations such as IAPT, Improving Access to Psychological Therapies, where you can self-refer. Every single borough has an IAPT department within their mental health arena, and you can look up the number and ring, and you know, somebody will do a triage with you over the phone, and you can connect with them in that way. You have the Pastors Network, which is the network of faith leaders who did the systemic family therapy training, and we offer a service to people, and it's a case of ringing a number and being allocated with one of the practitioners to speak to. There's low-cost counselors in the different boroughs. There's also websites. Some of the websites are absolutely brilliant. Mind have a well-being hub that you can tap into. You also have, you know, things like there is another website called Anxiety UK, and you can you know, go on that, and they have really good hints and tips on how to stay well, and when you're feeling in certain ways, the sort of things that you can do. So what I will do is I will give you the some of this information, and that can be included in
yes, we will put it on the screen.
In the broadcast. But there is a lot. The one thing I will say is, don't sit and think there's nothing that I can do. I'm feeling this way and I just have to put up with it. No, there is a lot out there. And since the start of COVID-19, a lot of organizations, be it community organizations, voluntary organizations, the public sector, they've put a lot of information on websites. Local authority websites have loads of information on. So there's lots of help out there. Just go out. Don't sit in it. Go out and look for it.
Excellent. Thank you so much. A lot of those information, we will share it on the screen so you can note them and reach out. But thank you so much, Lystra, for that helpful, you know, information and the sharing of your own personal journey as well. Really grateful to have you on. I look forward to more conversations like this. But until then, it'll be goodbye. Thank you so much.
Thank you very much. Good luck with the rest of the videos.
Thank you.
Bye.